A question that I often get here at Kayla West. Hi, my name is Richelle. I'm the lead practitioner over at this office and medical office space where we specialize in bioidentical hormone replacement therapy. One of the questions I often get is what type of labs do you check respective to my hormones? Depends if you're male or female, but let's say for female, peri, pre, and postmenopause. I like to check all of the hormones. Now, some practitioners do not believe in that and do not practice it. But what I mean by that is I like to check your hormonal hierarchy. So something called pregnenolone, which is like the grandfather of the pillar of your sex hormone cascade. DHEAS, which is your predominant source of DHEA. You make it in other places in the body too, but your adrenal glands is the biggest supply. So I like to check your DHEAS. I check your estradiol, I check your testosterone, total and free. There's a difference. Total is what you have in the reserves available to be used, but it's bound up to a protein called sex hormone binding globulin, a vehicle carrier until it's ready to dump you out, and then it's called free testosterone, and free testosterone is what's actually doing the work for you. So things like libido, exercise performance, good sleep, mood regulation, improving your insulin sensitivity and such. So we check a total and a free testosterone because they're both relevant to you. We also like to check something called your FSH and LH. They're pituitary gland hormones that sit up in the middle of your brain like a little punching bag. And that helps clue us into how well fed you are overall with estradiol and testosterone. Also gives us an indicator if the thermostat is working between the sensing mechanisms of the pituitary gland down to your ovaries and your adrenal glands and the hormone signaling that should be going on, which also helps us track then if we are placing you on hormone therapy, that sensing mechanism is correct because it will vary depending on how well fed or how well not full you are downstairs going on between the pituitary and your adrenal gland and ovarian axis. So we'll check that as well. We also can check thyroid. We check a full thyroid panel, not just a TSH like they do at primary care in your OBGYN office, perhaps not a down dig to them, but we'd like to do a little bit more of an extensive Nancy Drew solving. So we'll check your TSH, we'll check your total T3 and your free T3, we'll check your total T4 and your free T4, we'll also check your reverse T3, and then we do check for thyroid antibodies, your anti-TPOs, and then your thyroglobulin antibodies as well to see if we have any type of presence of inflammation or autoimmune markers working against the impact of your thyroid that can come from stress, environmental illnesses, or environmental unhealth, can come from leaky gut syndrome and things of that nature. I also like to check an A1C just to get people on board with where their insulin sensitivity is, and then I can also check their insulin fasting as well. But that's the basic panels of what I like to offer when somebody comes into my office and they say, hey, I'm a menstruating female, I want a hormonal update. Or hey, I think I'm in perimenopausal transition, can you tell me what it's looking like? Or hey, I haven't had my period for 2 years and I'm just feeling real tired. Can you tell me if I'm actually menopausal? Those are the things I like to offer up front because they matter most and they're the foundations to bioidentical hormone therapy, replacement models, and then offerings of things that we have to get you out. Now for a male, what I like to check, and I do this actually standard for both male and female, I always grab what's called a CBC and a Chem 14. So those are things that look into your white blood cells, your red blood cells, your platelets, also your electrolytes, some of your liver enzymes, a little bit of like AST, ALT, bilirubin, what else? Some of your renal function. I digress, but I check that standard just to get an idea of who you are. Are you filtrating things? Will you be able to process drugs by the liver or your urine stream, renal function, etc. So those are standard, kind of free for all. They're pretty cheap. But when it comes to hormones for males, what I like to check for them, total and free testosterone, absolutely. I also like to check the pregnenolone and DHEAS for them as well. I always check a PSA for them, a little bit of a insurance package. We can talk about all the things that go on when it comes to PSA and is it a good marker or not, but we check it a little bit because of legal purposes, but then also just because we think it's safe and well to have on board. What else do we do for males? Males are a little bit simpler on their panel, but that's about as much as we do, along with the thyroid that females also get and along with the A1C and insulin checking as well. So that's a lab panel that you can standardly expect, standardly a word, standardized at a Kayla West initial consultation appointment when you want to say, hey, I just want to check on my hormones. You can anticipate all of those labs coming your way, but we do offer other things. Oh yes, on a male, we can check FSH and LH too, I forgot, excuse me. But if we suspect you have pituitary dysfunction, we might check things like a prolactin. We might check things like a human growth factor, Z-score, to help us kind of round out what's going on. Also, that we like to check on females is called an NTX score. It's a urine score, actually, or a urine lab that tells you the rate of bone turnover. And you can get that every 3 to 6 months to kind of assess your bone's performance, because your bone's always in a remodeling process. And you can get this in between your DEXA scans to kind of give you more day-to-day real-time evaluation rather than have to wait every year to 2 years to re-update the DEXA. Those are kind of some of the things that are standard at Kaelon West that we're looking at routinely when it comes to a hormone type appointment. So feel free to reach out if you have a question about any of those things. We do think our lab panels are a little bit more extensive than what you get at just a traditional primary care or OBGYN. But they're not vastly extensive to where they'll cost you a ton of money, but they are more well-rounded in their hormonal hierarchy of evaluation, and we believe you deserve that when you're trying to collect your information about your health.